So when did you all first notice something might be going on with Landon? What happened?
So back in October, Landon started limping on and off. With activities, the limp increased.
And just he had enough and he was at his breaking point.
I said, let's take him to CHOP urgent care. That's the quickest way to get the right diagnosis.
If anyone was going to find out what was going on, that would be the way to go.
Once we were able to see Landon, evaluate him and examine him and get some basic x-rays, it was pretty clear that he had a diagnosis of Legg-Calvé-Perthes disease, which is a very unique and rare disorder that can affect the children's hip.
It's quite the adjustment because we're walking in just thinking growing pains, and then I'm pushing him out in a wheelchair. It was a very 360 from what your thought process was in the span of just like an hour.
So Legg-Calvé-Perthes disease is essentially a disease of blood flow to a child's hip. The blood flow to the hip is actually relatively tenuous, and the vessels that supply the nutrients and the oxygen to the hip can be compromised, and they can clot off or be obstructed, and that basically starves the bone of the nutrients and the oxygen that it needs. If Perthes disease goes untreated, the ball of the hip can deform, and that shape alteration is what leads to the problems, the stiffness, and the pain that some patients can experience. And that can happen in late teen years, in their 20s or 30s, and eventually a lot of those patients do require hip replacements earlier on in life. When I met Landon, his range of motion was really markedly decreased. He had a lot of trouble bringing his leg out to the side. He had a lot of trouble rotating the leg. And that's a sign that the hip is extremely irritated. It is extremely active in terms of where it is in the disease process. And in turn, it's at risk for flattening and getting deformed. I recommended going through a trial of what we call Petrie casting. Petrie casting is essentially a cast on both legs, separated by a bar, and that essentially stretches him out, brings his hip back into a better anatomic position, and helps rest the hip. And all of that is extremely, extremely valuable.
The primary goal of the casting would be to get the hip in and contain it by way of an external device. So instead of containing it internally with surgery, I would contain it externally by positioning with legs.
The outcome for kids with Perthes disease really depends on how round or spherical the ball of the hip is.
And that's what we want your hip to be like. Yeah.
But it does have a little...
Yeah, so keep working on it.
It does have a little flap.
It does have a little... Right, so I need to keep working on it. Oh, that's what we don't want.
Yeah, we don't want that to happen.
Okay, we want round Play-Doh.
We don't want this.
We do not want that.
We don't want this.
Do not.
Definitely don't want that.
Okay.
There can be a huge range of initial information that these patients get. And part of that is because the disease is relatively poorly understood. So there is a lot of misinformation out there, and there's a lot of different opinions on how to handle this, even amongst experts that treat Perthes. In Landon's case, we needed to do the casting to rest his hip and regain his range of motion. In older kids and in kids that have more severe involvement, we often do recommend a second stage surgery to help contain the hip and try to prevent flattening of the femoral head. So it's really key that anybody be seen by a center that has a lot of experience taking care of patients with Perthes and really has the breadth of experience to draw upon to figure out what individualized treatment plan is best for that specific child.
So we went back into a room with Dr. Sankar. He showed us the images and how his femur head was moving in the joint.
And it was actually nice to see that imagery that he had. It gave you a much clearer picture of what it looked like and what the rotation of it looked like.
This morning I was very, very anxious leading up to today. I was anxious. Landon was anxious.
I
You were
Yeah,
scared.
he was a little nervous.
It feels good that he's okay. He seems to be mostly okay with everything.
And it is nice to you have something on your list, a date that's coming up, things that need to take place for him to get on the road to recovery. So this was the first thing that needed to happen to kind of start that timeline. I think the next 6 weeks are obviously probably going to be the hardest part of the whole process.
So you go in and out, and then I try to bang.
No, you don't have to go
Oh,
in.
I already got it split in half.
Got you.
Oh.
How has it been having the cast on, Landon? Good. Medium.
Is it hard to sleep sometimes?
It's super hard.
Super hard to sleep.
While he can get, move around and scoot around on the floor, he mostly just wants to sit and watch shows because there really isn't much that he can do. Typically, he would be on the floor wrestling with them a lot, which that part he's not really doing, although sometimes they still do.
Get back here!
His teacher sent us a picture of, I think it was his first day in the cast, and we had like a line of students lined up to like sign his cast. It was nice.
The boy's actually filled.
The bar is filled with signatures.
Yeah, you can't
On all
get
sides.
any more signatures. Let's time myself. Time me, Dad. Danger. Time me, time go.
He has a starting point, he does a loop around the house, and we time it so he starts and stops and he tries to beat that time. 22 seconds.
No!
Good job, bud.
I can time you again.
What's your fastest ever, Landon?
20.
20 is the fastest you've ever gone?
Let's see if you can beat it. 3, 2, 1, go!
It's hard to really take him anywhere right now
Yeah.
because his wheelchair is just so
It's massive,
big.
yeah.
And loading that up in the car, getting him into the car, getting everything out when we get where we're going. So when we go anywhere, normally someone is staying home with Landon while the other one is taking the other two where they need to go.
What are you looking forward to when your cast comes off?
Also, doing everything.
Doing everything again?
Yeah.
Mm-hmm.
Look at that.
Oh!
Your leg! Here you go!
Just like that.
You're free!
6 weeks after being in casts, we took them off and we got him into physical therapy to get his knees moving because those were really stiff after having been in the cast for a few weeks, and then to keep his hip moving. He was really good about being on crutches and using a wheelchair to help protect his hip. We had kept him in a night brace during this period to help keep the stretch that we had obtained from the cast that he was in previously.
The hardest step is over, okay, with the casting, all right? Yeah, that's right. All right, buddy?
Yay!
All right, take it easy, kiddo.
We saw him every few months to make sure that he was maintaining his range of motion and that his x-rays were moving through the stages of Perthes.
So I will let you start walking, which is really exciting, okay? I am really hopeful we can get to see a little bit more bone at the next visit and loosening up the restrictions even more.
One of the things I love about taking care of patients with Legg-Calvé-Perthes disease is that I really get to know the kids and I really get to know the families and form these really important bonds. And that really makes all the work really worth it when you really make those connections with people and you see kids go from a situation where they're in pain and they're limping and they can't do anything to a year or two later being happy and out on the fields and doing the things they love to do.